Welcome to Dementia, an overview for first responders, presented by the Colorado Behavioral Health Administration. In this 7-minute course, you'll deepen your understanding of dementia and learn about strategies that may be helpful with individuals whom you may encounter in your role as a first responder. After completing this course, you may have the opportunity to participate in a facilitator-led, problem-based learning activity that will help you apply the information covered during this brief learning event. This activity would be held back at your station or office and likely led by a department trainer or supervisor. Take a moment to review the course objectives listed here.
Sir, I need you to calm down. Everything's going to be okay. Help is on the way. He got very upset and started yelling at an employee who was trying to help him. Then he said the employee stole his wallet? I think he might have memory problems. I'm not sure he knows why he's here. He seems to be here alone, too.
Hello there, sir. Can you tell us your name?
James.
Okay, James. Can you tell us what's going on?
I don't remember. I was trying to find something.
It's all right if you can't remember right now. We're here to help.
Dementia is a general term used to describe the symptoms of damaged brain cells, which can have various underlying causes. Typically, 3 types of cognitive functions are impacted by dementia: memory, or storing and finding information; attention, or the ability to concentrate; and executive functioning, which describes our ability to make choices, plan, and set goals. There are many types of dementia or underlying causes. Alzheimer's is the most common, and it accounts for 60 to 80% of dementia cases. Dementia affects 1 in 10 Americans aged 65 and older, and while rare, early onset dementia can occur in younger adults. In addition to these individuals, another 2 in 10 adults aged 65 and older have mild cognitive impairment, which is less severe but may be a precursor to dementia. The risk of dementia increases with age, and dementia affects more than 1 in 3 Americans aged 90 and older. Indicators of dementia include problems with memory, such as repeating themselves, forgetting appointments, or losing things. Another sign is difficulty with attention, including needing more time to process and making mistakes with simple tasks. Executive functioning is also impacted. People may have difficulty finding words, following instructions, organizing, completing projects, or making plans. There are often behavior and personality changes. These include becoming fearful or paranoid, becoming easily upset and unpredictable, a tendency to be more angry, frustrated, and aggressive than they were before, feeling confused and disoriented, and a higher risk of feeling depressed or apathetic, feeling as if or saying they don't care about what is going on. Finally, many individuals with dementia develop various mental health symptoms, including mania or psychosis. Dementia-related psychosis can exacerbate the problems caused by cognitive decline. Common delusions among those with dementia-related psychosis include that people are stealing from them, they are in danger, there is an unwelcome person living in the house with them, or that others aren't who they claim to be. Common hallucinations include seeing things that aren't there, talking to people who aren't there, and hearing voices. The lived experience of dementia can be very challenging, as the individual is constantly adjusting to change as their abilities diminish. They may also be constantly striving for a sense of continuity in their lives because things that used to be easy to navigate are now very difficult, and they may feel a lack of grounding and changes in their identity. They can also experience challenges in their relationships as they have to renegotiate their abilities and how much help they need. they often have a fear of being a burden to their loved ones. Another common experience is having to navigate challenges with the physical environment, as their memory difficulties cause loss of the ability to complete daily tasks and remember where things and places are. Things that were once familiar are now strange and unknown. The cognitive challenges can also make things feel tedious in the present, as the person is always waiting for the next meal or the next appointment. This can be combined with a fear of the future, as the person often cannot remember upcoming plans that have been made for them, and they fear the continued loss of their abilities. Individuals with dementia can also be prone to reliving trauma that has occurred earlier in their lives. Unfortunately, traumatic memories may be more likely to be remembered than happy or mundane activities, and their sense of time can shift and make them feel as if the trauma is happening in the present moment. Because of all these experiences and others, individuals with dementia have an increased risk of suicidality, which may be higher in the first year after the diagnosis if they are diagnosed before age 65 or if they have an underlying mental health disorder. Also, individuals with dementia are at risk of victimization from others, as they are considered easy targets for thieves and scammers, and they can also be abused or neglected by people caring for them. Caring for an individual with dementia can be very challenging, requiring the caregiver to take on new roles and responsibilities that can require a very substantial amount of time and may cause caregivers to have to leave their paid work. When individuals with dementia require constant monitoring for their safety, there can be an overwhelming workload on caregivers, causing physical and emotional stress as well as financial stress. Caregivers may delay caring for themselves and may experience disrupted sleep if the person with dementia wakes at night, which is common. The constant demands may cause loneliness and isolation, anxiety, depression, and strained relationships, particularly as their own roles and priorities are impacted by caregiving. Some dementia-friendly approaches that can help you navigate encounters with people with dementia and their caregivers include ensuring that you don't exclude the individual with dementia from the conversation, such as talking about them with their caregivers or others when they are present. Using active listening skills, including giving your full attention, nodding, and clarifying what they say. Also, be mindful of body language. If the person seems nervous, slow down and try to reassure them. Maintaining eye contact to help them focus and using slow and clear speech. Sharing information in short, simple chunks and give them time to process, as their working memory can be impacted. Additional dementia-friendly approaches when encountering people with dementia and their caregivers include using gestures or visuals to make your meaning more clear and only focus on one point at a time. Narrowing choices that you are offering to prevent the person from becoming overwhelmed. Understanding that they will struggle to follow commands or answer questions clearly. Be realistic about what you expect and be patient. And finally, encourage caregivers to prioritize self-care, including taking breaks, talking with friends, family, or a counselor. Dementia can affect many cognitive functions in addition to memory. Important behavior changes can include agitation, aggression, mania, and symptoms of psychosis. However, it's important not to jump to conclusions if a person with dementia makes an accusation, because these individuals are frequently victimized. Even if the accusation is not entirely accurate, something may be going on. Dementia is a very stressful experience for the individual as well as their caregivers. Communication with an individual with dementia can be challenging, but the strategies discussed here can help facilitate effective communication. As we touched on at the beginning of this topic, problem-based learning materials are available to your team to help you further explore the interactions with individuals with dementia you may encounter in your role as a first responder. Thank you for taking the time to learn more about this topic.